It is Medical Monday here and Now on 3, and joining us to talk a little bit about brachioplasty or arm lifts is Dr. Asfa. Thank you so much for coming in today.
Thank you for having me here.
And I know you mentioned before the interview there's two approaches to this, one minimally invasive, one more operational. So tell us a little bit about those two approaches.
Sure. Brachioplasty or arm lift pretty much is the procedure, top procedure for especially people who lose weight. For example, between 20, 30 and goes up. So in this procedure, we are pretty much dealing with either excess skin or excess skin and fat. So each procedure addresses different area. If the patient has some area of the skin laxity, we only go ahead and remove the skin. But if they have also fat, it's combined with the liposuction. And you mentioned there are two different things. Let's go with that one. For example, this patient, this is a minimally invasive, which means the patient has some fat, some skin, but is not a lot that we have to address it under general anesthesia. So we perform this procedure in office under local anesthesia with some oral sedation. Recovery for that one is not even a week. It's not that long. As you see, this patient, they have some lax skin in this area, some adipose, and this is a post-op tissue. The incision for this one is like a tiny pin area. It's not that one. As you see, this is another one that the patient was dissatisfied with this area of the lower part. Some people, they call it wings, they call it overhang skin. And this is the after surgery, about 2 weeks. And as you see, the incision is right here and it's healing, it's like a small area. This is another one. On the other side, you see again, the area that we add is lower part of the arms, liposuction, doing the skin tightening with the body type, which is the radio frequency. When it comes to the other area that we see, patient has lots of fat, lots of skin laxity. That requires to have intraoperative under general anesthesia performed. As you see, this area is post-op. There's another patient that you see completely wings around that area. Patient had some weight loss, and this is pretty much the area that after surgery.
And then for those, I know you mentioned there's also maybe not a negative side effect, but for those that choose to get that more intraoperational service, what is the impact of that?
The impact, that's the service, as you see. The worst scar in plastic surgery, we usually want to put it on the board question, as somebody who writes a board question for American side of plastic surgeon, the worst scar is the brachioplasty. So pretty much is the trading. If the patient has wings and lots of skin laxity and that bothers them so much, yes, we can address it, but they have to deal with the scar. Some people heal nicely, some people, they have a long scar. Usually it's hidden when they put their arm up, but this is pretty much trading. For this procedure, which is going to be at the hospital, the recovery for that one is about 2 weeks. And again, it's something that patients love it, but they have to deal with the scar.
All right, and then for those that see this segment, they maybe have questions about the brachioplasty procedure. How can they go about contacting
They can always ask them, call the office. We're going to put the information and ask questions.
All right. Thank you for all this information. Hopefully this helps some people out there maybe tempted to get this procedure, and thank you for your time today.
My pleasure, especially the summertime. They see it on the pool and the beach area, and that's something that we can help them with that.
Oh yeah, for sure. Thank you.
My pleasure.